Now we give the floor to Walter Ricciardi. He's a long-standing friend of the Isa Pulire Forum. I give you the mic for your contribution.
Io avevo ricevuto qualche...
Thank you so much. Some days ago I received the video and I found it so highly inspiring, and yesterday I showed it to my residents to show how important it is for Italian companies to be fully aware of our past. And I'd like to stress a point, and perhaps you are not so fully aware of how important you are as an absolute value, but as a guarantee for the sustainability of the national health system in the country. And I understood it when you said in the video that 3 people die every day. You didn't say that every day a higher number of people die of healthcare-associated infections. And so this trend is a unique trend in the European scenario. Italy, on its own, has 50% of healthcare associated infections in the European Union. When I was president of Istituto Superiore della Sanità, there was an inspection performed by the European Commission, CDC, and World Health Organization, and they said it happens because in Italy you don't have awareness and you need to have an awareness of this negative trend. Other countries fight against such cases. And so the World Health Organization, the European Union, and CDC said there's no awareness at the center, in the periphery. There's no awareness of health operators. And in this case, unfortunately, health operators transmit hospital infections, and the pandemic didn't improve the structure. It's what is happening in Italy, and not just Italy. The only country that withstands this crisis is Germany, and the other countries simply express wishful thinking. We like the pandemic and the virus to disappear, but the 8th pandemic wave is just started, and very few people got the 4th vaccination, and Professor Damiano had 4 vaccinations, and you're really protected against severe disease and death. But you have 80% of people over 70 years of age who were not vaccinated, and some people didn't even get a single vaccination, and others the 3rd one. What happens in front of this wishful thinking? The count of patients and deaths and the toll will increase when cold weather arrives, when we stay in crowded environments and workplaces. It will be a problem. In Great Britain, July 19th last year, they removed every safety measure. It's a catastrophe, and citizens don't realize it immediately, and they're happy. They don't have to wear masks and to go back to their usual activities. But when they are in a hospital, they regret it. What happens in the hospital? They go to a hospital with severe diseases. For example, in 2022, Great Britain had more deaths and hospitalization than in 2020-2021 put together. But especially here, we speak about professional safety, and 200,000 health operators got long COVID. Health operators and as masks were not compulsory in hospitals, they got COVID 3-4 times, and this virus doesn't give permanent immunity, unlike what many people think. You can get it 5, 6, 7 times, and each time you get it, it causes a damage to the endothelium, a systemic damage, and you can have a brain, heart problems, and in 12% of the cases, you're exposed to prolongation of symptoms for weeks and months. 200,000 operators, 2 million Britons, 4 million Americans, and in America 1.5 million deaths. Those values mentioned in the video, and it's inspiring, and some way or another we should be more aware and put at the center scientific evidence. I don't think that in our country we're doing it, but we need to strike an alliance between medicine and politics, and we should also be extended to the industry, to enterprises, and products and markets should be conceived in a different way. It's useless to have sophisticated technologies. You have public administration that doesn't understand the value of it. It's useless to have technologies that have been created thanks to savings. If you have bureaucrats in front of you simply considering the lowest price, who do not consider what the technology can bring about in terms of advantage to patients and operators. I'd like to remind you, in our country, together with Germany, we have the oldest health operators, and they get ill, and very often they don't go back to work. And our country, in the case of emergency medicine, we don't have young physicians and in emergency rooms, for example, and just like in Great Britain, you end up there without knowing how it ends. But this situation can spread all over the health system. There was an evidence-based research saying that infectious diseases, for what we said before, it's not mortality connected to infectious diseases, but antibiotic resistance and healthcare-associated infections. If you speak with physicians today in hospitals, they're scared that a patient can get an infection, and they try and limit stay in hospitals, because hospitals are one of the most dangerous places in the world, specifically in Italy, and 50% of patients die compared to other countries. And confronted with this scenario, we should act. President Napolitano was extremely angry because there were 3 deaths, and we instead, the university politicians, we should prevent 150 fatalities a day, and this number can increase, and so we should protect the health of citizens, but also of workers. Thank you so much for your attention. Thank you so much, Professor Ricciardi. And then now, very briefly, at the end of your contributions, I will ask you something. And Ricciardi has a long experience in Italy, but also abroad. And later, I will ask you something that makes me curious.